I am Dr. Ram Narayan, consultant functional neurosurgeon. Now I will talk to you about epilepsy and how surgery can be effective in patients with epilepsy. I am sure all of you know about epilepsy. I am not going into the medical side of epilepsy. But one thing is very clear which affects everybody is that epilepsy has got a lot of social connotation. So obviously epilepsy needs to be treated. And second thing is obviously it affects the brain, so it needs to be treated. There are various types of epilepsy coming on one side of the body, coming on both sides. Patients may lose consciousness, may not lose consciousness. So there are so many varieties of epilepsy. The usual treatment of epilepsy is with medications. There are so many medications available in the market, and the neurologist by trial and error can find out which works best for a particular patient. Most of the patients do well with the common drugs and do not develop any long-term side effects. But there are some patients in whom the medicines do not work or may cause significant side effects. Or there are some patients who may have problems which can be identified in the brain. In those patients, we can offer surgery as a method for treatment of the epilepsy. What are the various methods of treatment of the epilepsy? The epilepsy, as you all know, occurs because some part of the brain is irritated and produces an excessive electrical discharge which spreads to one or more areas of the brain and causes movements of the opposite side of the body. Of course, this is a very simple way of looking at it. So if you can identify this focus and you can remove it, then the trigger is taken away so that the patient will not get fits later. The commonest situation which happens in this scenario is what is called temporal lobe epilepsy. That is, temporal lobe is one of the lobes of the brain, one of the areas of the brain. The temporal lobe causes, especially the medial temporal lobe, causes what is called temporal lobe epilepsy. So if it is possible and it is practical to remove the medial part of the temporal lobe so that the patient does not get epilepsy. This surgery is called temporal lobectomy. This is done very commonly. But the most important thing is that the surgical team and the physicians and the radiologists, all this, the epilepsy team has to show that yes, this is the area from where the epilepsy is starting. So they had to do MRIs, so many investigations, clinical assessments, so many things have been done. So there should be a concordance of all this input. But this is only probably 25% of the patients who have uncontrolled seizures. So in those patients, the rest of the 70-75%, what can we offer? There are two other methods which can be offered. One is called vagal nerve stimulation. Vagal nerve is a nerve which starts from the brain, which goes down the neck like this, which comes down and supplies the heart, the intestines and all that. So studies have shown that when you stimulate the vagal nerve here in the neck, you can actually cause reduction in the quantity of seizures. So you just like other stimulators like pacemaker, you put a stimulator here, you connect the wire to the vagus nerve which is deep inside here, and you can control the seizures. This is very effective. It's a very simple surgery, but the disadvantage is that it does not abolish the seizures, it only reduces the frequency of the seizures. But otherwise it's a good surgery, it's a simple surgery, and the complication rate is practically nil. So nowadays what we do is we do what's called the deep brain stimulation of the surgery for epilepsy, that is intractable epilepsy. There is an area of the brain called the thalamus, and there is an area of the thalamus called the anterior nucleus of the thalamus. When you stimulate the anterior nucleus of the thalamus, you can control epilepsy. As I said earlier, for Parkinson's disease and other things, we use two electrodes which is put into the brain through the small burr hole, very small holes, pin-sized holes, and we stimulate this thing by putting a battery here. With these surgical methods, a good majority of the patients can be treated. Of course, there are some other very aggressive surgeries like hemispherotomy and all that, which is not practiced very common, but in selected specific cases, these are essential because these are very mutilating and very harsh surgeries. So it's not done very commonly, but yes, occasionally these are also useful. Thank you.